Hello, everyone. Welcome to the fourth and final session of the four-part series for Foundations of a Successful Coalition. This is, like I said, the last session. All sessions have been recorded and are housed on our Mountain Pacific website. And if I do, I think I do have a couple Mountain Pacific colleagues on the call. So if one of you wouldn't mind just putting that link in chat where you can find the coalition series, that would be awesome of you. So today we're gonna move on. It might be a little bit shorter session. We'll just kind of see just a couple housekeeping items. Again, just reminding everybody that if you're not speaking, if you want to just put yourself on pause or mute. And for those of you who aren't shy, unlike me, I am shy and not on camera. If you do want to put yourself on camera, that's very cool of you. Just be mindful of what's in back of you. We do appreciate, Mountain Pacific does appreciate your time and that you're joining us today. So with that, let's get going. So last week we covered the importance of building rapport and working as a team. And so today we're going to discuss, during our last session, we're going to talk about how you continue to ensure your work aligns with your mission and vision, along with conducting effective and efficient coalition meetings. And we talked about the difference between effective and efficient in prior sessions, along with conducting good meeting etiquette and delegated action items are followed up on. And again, of course, all of this happens when you have a good structured coalition and you've had that builded trust and rapport with everybody. We're also going to talk about how you prioritize your goals and knowing how to conduct a root cause analysis. We'll do a little bit of practicing at the end of this session. So the presentation itself is about 30 minutes long, and then it might be a little bit shorter than that actually. And then the last 30 minutes, we do some information and resource sharing as well as do some practicing. And then lastly, we're going to discuss your strategy planning along with action items and how to make sure you're utilizing your quality assurance performance improvement, otherwise known as QAPI, tools with your work. And also just wanted to know that we are internally discussing among our Mountain Pacific team more details on training for QAPI. So more to come on that, as well as and data training, as well as chronic disease and COVID learning and action network theory. So all of that is in the works. We're just busily screwing behind the scenes for you all. So if there's anything else that Mountain Pacific can help you guys with, reach out to myself or your Mountain Pacific contact. So stay tuned on that. You can also sign up for our constant contact list on our website as well if you want to know what's going on, what's coming up. There's a few other nursing home for those of you who are in the nursing home field. There's some series coming up on that as well. So last session on July 2nd, we talked about how you know you made a difference with your coalition by evaluation. So there's a lot of skepticism that revolves around evaluation, like we talked about, because it takes time and resources to put it together and analyze and apply those findings. And we discussed what examples are of specific roles within the coalition, such as a steering committee, chairs of coalitions, administrative roles, and just coalition members themselves. We also talked about establishing and maintaining a coalition charter to help all members understand their roles and responsibilities within a coalition. And some tips on how to help improve engagement with evaluation is putting action with it. And with everyday work, and that, so you have that practice for one, and that it helps with the coalition members to see the value in their work in the coalition. Also by using it to guide the conversation for getting the coalition members to talk about next steps as a team. And then we also discussed partnerships and collaborative decision-making with how important it is to understand your community and other collaborations to conduct work effectively. And we also reviewed some details on what it means to do a skills inventory with your coalition members, as well as the structure of your coalition to identify strengths and weaknesses. Otherwise, you can do a SWOT, a strength, weakness, opportunity, and threat. And there's tons of resources on that. Last, we went over how building trust within your coalition helps to establish meaningful and forward momentum work by setting the example as a coalition leader, and knowing your problems to find solutions, not to place blame, and to communicate. Can't stress that enough. So over the last 3 sessions that we've done in this series, we've touched on the importance of a purpose, vision, and mission for your coalition. We talked about the details that make an effective structure and how you obtain desired outcomes, rather than create more chaos. So as our last session, let's review that one more time for old time's sake. The vision is your bullseye, but includes input and consideration for the communities you serve. The mission describes how you will get to the bullseye and is a concise statement. You want it to show how you expect to achieve success, but not limiting, because coalitions need to be creative and think outside the box with what resources they have available to them. Then when we started talking about our goals and creating SMART goals, so you're specific on how to measure and by when. Then your objectives is how your coalition will provide more detail to the goal. And then your strategies are the actual actions you plan to take. Note I said plan, because you have to be flexible in your work and be ready for plan B, C, D, and so on in your work. All of these return back up to your top mission and vision to be sure you align with your goals and objectives with that. And so again, if there's any questions, comments, or anything like that, you are more than welcome to type that in chat or just unmute yourself. So key performance indicators are exactly what they sound like. They help to focus your work towards the goals set by your coalition. They help maintain a constant evaluation method of your work, so you know whether you're headed in the right direction or drove 800 miles in the wrong direction. They're not static, and the results will help evolve and justify the need to flex within your coalition. Again, using SMART methodology to help define and set your key performance indicators, or KPIs, will give you a better idea of the outcomes you're trying to achieve in relation to your mission and vision, of course. When starting your KPI, give it a name and state your goal. Then key in your details, such as who is this for, what is your audience, who can gather, analyze, and report this data in a meaningful way. And don't forget, if you're doing all this work, what do you intend to do with it? What's the plan afterwards? And how will you need to collect it again, and how often? And don't forget about sustainment. Also, will there be any limitations with your KPI or consequences of collecting it? So as you can see, the level of detail that goes into evaluating your work involves collaborating with multiple people and organizations to gain the best bird's eye view of the quality, quantity, and success of your coalition work. So last week, I talked about evaluations, not last week, but week before. Time is getting away from me. And making sure you know the direction for how and what to do with the results. A problem or root cause analysis helps to find similarities in problems, reduce or eliminate assumptions for how to solve the problem, and avoid future conflicts with your coalition by working together to talk about root causes. So how many of you went to a clinic before to be checked and you have some new issues, but instead of the healthcare team asking you detailed questions to identify the real diagnosis, the healthcare team just assumes everything and prescribes you something that doesn't help at all. So when you put that kind of picture into perspective and not using your full resources to help identify the real problem, you somehow have stepped away from the focus of your work. So putting those all into perspective, and when you think about the work you do in a coalition. As a nurse, we're trained to use the nursing process: assess, plan, implement, and evaluate. Similar to PDSA, Plan, Do, Study, Act, the root cause essentially puts your problems into a systematic process to being able to understand how to strategize your coalition work. In one of the other previous sessions, I also discussed the 5 whys, and I think that was our last session, define the problems, and applying this to your root cause. And voila, you have a structured system to use for your root cause. According to Community Anti-Drug Coalitions of America, they conducted a primer for community assessment and reviewed 6 reasons to conduct a root cause analysis, which are: understanding of relationships of problems, and an example they gave was substance abuse and teen pregnancy, and other community problems or concerns that affect them. To give a clear, complete picture of the problems, you have to lay them all out, put them into an understandable format so your coalition has accurate information to identify the real problems. You know what they say about the word assume. It makes an ASS out of you and me. So by giving the opportunity to examine, discuss, and apply known factual data, community experience, and pragmatic reasons for problems, this eliminates the conflict among coalitions, as I mentioned previously, and helps to encourage consensus with your coalition. Another process in nursing that I appreciate to apply to coalition work is rationales. When you conduct a structured, systematic approach to identify problems, finding the root cause gives rationale to the problem statement. And last but for sure not least is prioritize. And once you have unpacked and laid all the knowns out on the bed, you can figure out how to prioritize your work for the coalition. So by laying out the known problems, you can then move forward with creating a logic model. Also remember that conducting a root cause does not lie within the hands of 1 to 2 coalition members. It takes a team to conduct, and why setting your roles and responsibilities out early, along with your coalition member expectations, this helps to reduce that feeling of the more work reaction you may get as coalitions. Thank you, Deb. She just posted the recording from June 4th in there. So a wonderful tool that I have used many times in this coalition work and in this presentation, as well as giving evidence for coalition work in this training series, is from University of Kansas, and in the Center of Community Health and Development, they created what's called the Community Toolbox, which has wonderful resources, templates, examples, PowerPoints, and other sources of evidence-based work in coalition work. Under Chapter 8, it's dedicated to VMOSA, which stands for Vision, Mission, Objectives, Strategies, and Action Plans. They call it a blueprint, basically for how to move your dreams to actions in your community coalition. When we think about creating a strategic plan, generally they range from 3 to 5 years. With our current state of a pandemic, it's clear that our plans didn't always go the way that we have them written down. But giving structure to the coalition helps to ensure that you can speak how you are planning to achieve success for your goals. As I mentioned, the toolkit that the U of Kansas developed, they reviewed 5 types of specific strategies that can help your coalition's interventions, and they are providing training and/or enhancing skills, augment the services that are already existing, map out access issues, barriers to resources, and identify opportunities to help improve the outcomes, provide opportunity for rewarding efforts, for example, incentives for community members to volunteer, and last, create, edit, or do away with policies. Then with the action plans, use your SMART goal methodology to help include criteria for the action plan, such as who is responsible, by when, what additional resources may be needed, and if there's any other people working on similar work or the same work. When the actual interventions start to be implemented, does it make sense to do a small test of change with a PDSA or a Plan, Do, Study, Act? So you have more of a controlled effort and tracking of results. Or is your level of effort and action okay to spread out, yet still have a way to evaluate the results? And we previously talked about the importance of evaluation too. All of this, of course, takes practice and time. But when you do set yourself up for success with a structured plan, you not only have a validated, tried and true method, but it helps with recruitment and retention of your coalition members as well, because again, it helps for them to see the value in their work. So we have a polling question here, just to kind of get an idea, who would be interested in doing quality assurance performance improvement training this fall? Go ahead and type in your answers. Looks like some good results. We have a few unsures and some yeses. So tell me, for those of you who, if you're comfortable, if you're unsure, are you unsure of the type of training? Do you have something specific in mind that you would like to know more about in terms of QAPI? If you do, just type that in the chat box there. And of course, when we think of QAPI, quality assurance performance improvement, sometimes it can be overwhelming. And when we try and apply it, again, everything takes practice. And it'll never be perfected, even though some people are pretty darn good at it. But you have to be able to know whether or not you're flexing and being, yeah, yes. Perfect. Well, it sounds like most of you are interested in some training. So our team will meet behind the scenes and we'll do some planning for you guys. And again, if you have any suggestions or specific topics you want covered, just let us know. So also in previous sessions, we also talked about good coalition etiquette with good consistent communication. We also discussed logics for your coalition and knowing who can take notes, who manages the meeting, place, or virtual link, and having a method for your coalition members to provide feedback or address concerns. So in the chat box, type some tips that your coalition has done well in regards to holding coalition meetings. Unsure because not knowing yet because of uncertainty what will happen with COVID and demands on time. That is so true. I can definitely speak to a little bit of that even with our work within Mount Pacific. You know, with COVID, we've all had to kind of reconvene and reorganize ourselves as coalitions to figure out how we're gonna conduct meetings and tracking tasks done and undone. Thanks, Amber. One of the coalitions that I'm part of is American Indian Coalition, and in a lot of the tribal communities, we think of connectivity and ability to get on Zoom, you know, with internet and everything else. And I think that can definitely be said as we move forward, and that question is still lingering out there for a few people for if school's going to start. And we kind of fast and furious learned that this last spring that a lot of kids and families have issues with having computer access, internet, and things like that. So when we think of our coalition work, and we talked about plan A, plan B, plan C, you know, how we're going to hold our meetings and how we're going to do our work, we have to really be creative. Excellent communication in our coalition, yes. Shelley, do you feel like that really helps your coalition in terms of moving forward and having that progress?
I think it does. I don't, I have a conflict during that time, and so I only make like every other meeting. And even if I don't make it, I get enough communication from the leader and from other people in the coalition that I don't feel like I'm not a part of it.
Okay. How about anybody else want to share? You can definitely just come off mute. And I think we did, Marlo, you had asked if the links can be sent via email. I think you were referring to resources and things like that. And I see Mary posted a link in chat for our tools and resources. So anybody else have some good tips and tricks for good coalition etiquette? Nobody? Quiet bunch. So we also previously touched on establishing roles and responsibilities for your coalition. And do you all feel like you know your role and responsibility and your expectation to the coalition and of the coalition? You can just type yes or no. So as a coalition, you'll naturally have members, like you've probably all seen, flex back and forth and with stepping up and doing the work, because it's really based off of what they feel adds value to their organizations or vested interest. And so creating that common language and that common purpose understands whether or not that is a vested interest for them. And then coalition leaders aren't a black and white definition per se when we think of contribution to making a difference you're working to see. But understanding your role and responsibility within the coalition is just as important as understanding the expectations from you in your job. In order to contribute to the success of the coalition, the members, they do need to see what expectations and goals the coalition has of them. And not only do you want to define how much time is expected or what types of resources are needed to achieve the goals, but think about that sustainment. And I said that, before too, with the coalition. If the members have that clear expectation, see the vision for the coalition, they too are able to recruit more coalition members and help spread and sustain your hard work. Doing roundtables at the end of the meeting also allows everyone an opportunity to contribute. I appreciate that. That's very, very true. And Amber said, it's always nice to do an icebreaker too if people don't know each other well. I agree with that. Provide a summary at the end of the meeting. Yep. Anybody else want to come off chat? And Dave, I know you're on. You said yes. And Dave is from the Billings Community Coalition in Montana, and he's done a real good job with right now just for getting the coalition together and identifying guest speakers to come on with in terms of talking to COVID and updates. And Dave, you can definitely speak more to it than I can for your next week for your coalition meeting. You have a guest speaker coming on.
I do, Alona. The biggest challenge as I see it is the members or the participants having enough time to participate in those 1-hour meetings each week. And beyond that, because of what's happening here, especially in Yellowstone County, and I assume elsewhere, simply being overwhelmed by the day-to-day demands of everything that's related to COVID-19. So just when we thought we were sort of breaking on top here in Yellowstone County, maybe a month ago, I've sensed that people were willing now to talk about doing more than simply dialing in once a month and listening to a guest presentation. Mm-hmm. Now with what's happening statewide, and especially here in Yellowstone County, I've noticed that we've receded a little bit, and the willingness to do more has gone with it. So while all of us, I think, understand not only what our roles are, but the critical nature of the work that we do, until we somehow figure out how to deal with this new normal, if it's going to be a crisis mode every day, my concern is that the level of participation and the level of commitment is going to be conditional. And we all need to recognize that's the case. I'd love nothing better than to focus on the reasons that the coalition was set up here in Yellowstone County to deal with the issues of transition in aftercare after people are discharged from the hospital, because one of the things that we wanted to do here was to comply with the requirements of the ACA and control the number of hospital readmissions. To my knowledge, since I came on in March, we haven't uttered a single breath of that, let alone all the other issues that we wanted to deal with. It's all been about COVID-19.
Mm-hmm. Yep. And
I'm not suggesting that we're alone. I know from having talked to other coalition members in other places the same thing is happening in other parts of the state as well.
Yeah. And I would say nation for that matter. I know we have some coalition members and Mountain Pacific team that between Hawaii and Guam and then Wyoming and Alaska, just being able to have that opportunity to listen into some of the coalition meetings. It's very similar in the nature of, kind of the side effects, if you will, of COVID and how that affects the organizations with staffing and with education and service lines and just operational concerns too. A big thing that you mentioned, Dave, was care coordination. That definitely is, I think, across the region for Mountain Pacific, that is a very common concern among many communities. Anybody else have any insights? How is your coalitions doing in terms of being able to meet and dedicated time and willingness to participate and engage in the coalition? How about some of the Wyoming folks?
Hey, Alana. This is Crystal, and I'm with Dave. We were kind of making we actually had our strategic planning, and we had made some plans for some projects that we were going to start on. And so I'm with Dave. COVID hit, and that's just everything halted, and it's hard to get the coalition back on track. And it's been a lot of information sharing, and we've had like the same of what he's doing, epidemiologists, and people still want to know, and so they're still focused on that. So it's that's where we're at.
Mm-hmm.
Lana, this is and in terms of the coalition, one of them had been existing and had kind of lapsed for about a year, and so I was trying to get it jump started again. And we've met twice now in June and July, but it's really slow going. You do just get that sense that they are having a hard time really thinking about taking on a new project. And then the other two areas that I'm responsible for, even just trying to get a small group together to talk about potential for a coalition. It's just really hard to build the interest right at this time, because a couple of those counties that are in those regions are really hard hit, experiencing some of the highest caseloads of COVID in the state. And so just even broaching the idea of starting a new project that doesn't really, that would be all volunteer driven and all of that is just not getting a lot of traction right now.
Yeah. Did somebody else want to speak up? I think.
Oh, Alana, this is Debbie with Bozeman. I was just going to say that, our membership is down a little bit, but yet we had a couple of good meetings where we identified some key goals. I think now it'll be key if we can move that momentum forward to really defining those goals, taking action, and, having the energy and support to make progress, which might be a little hard in the COVID environment.
Yeah.
But we're going to try real hard.
That's a good way to the good attitude. Just keep trying. Maggie had mentioned, goes back to patient safety, keeping the community safe too. Agree with that, and how the community healthcare partners can help each other out. Jen, I feel like COVID has really derailed us. I completely agree. Even with our CMS task order work at Mountain Pacific, when we start to strategize with our work, we really have to think about how COVID is going to affect XYZ in this, and understanding that as communities, and me, we're all community members, what interventions are going to be value added and beneficial to me in terms of the work that we do within coalitions. And I think that when we talk about, you know, floundering coalitions, and I say that loosely, and I hope that doesn't offend anybody when I say floundering, but it's how I kind of vision it. We're just kind of trying to figure out our steps again here. But establishing the fact that COVID is the first and foremost priority in a lot of communities, because there's so many unknowns in it. And it's so hard to get data. And I think that's the scary part for all of us, is that we don't really have some really factual black and white data to give us a direction on what step we need to move forward on. So Brandy had mentioned Million Hearts Collaborative has been slow moving for Wyoming as well. We're in the forming stage and trying to engage clinics with competing COVID priorities. I would say that's very, very, very true for a lot of organizations right now. I think the Kalispell Hospital, they had a huge reduction in force, and then just listening, you know, some of my previous colleagues at Bozeman Health, they had to be laid off for a little bit because of, you know, COVID. Maggie mentioned opportunity to network and connect to discuss what is going on. Yeah. I think there is definitely, like I had mentioned, we're trying to lay that groundwork for COVID and chronic disease, because I feel that that is a very similar connection with all the coalition work regionally is with chronic disease, diabetes, kidney disease, heart disease, and how COVID, more and more research is showing how COVID is affecting that, and the side effects and the outcomes of COVID, that it's causing kidney damage. And so when we think about our metrics and we think about data that we're going to gather, how to interpret that, because, you know, it wasn't necessarily a life choice that most of us kind of think when we think of diabetes or things like that. It's something that it's an external factor that is causing our health to decline. So that we can do our best. We're all wearing our masks, and you know, high risk patients, diabetes, cardiac, kidney, and future care. Montana, the Montana governor, he just declared yesterday, the day before, that Montana has to wear every community in Montana with 4 more cases of COVID, active COVID cases, I think is how it's termed, have to wear masks. Grocery store, retail stores, restaurants, everywhere. So better get used to wearing masks for a while, everyone. So again, that presentation part, just 30 minutes. So now we're just going to open it up and do some open sharing. I do have a few more things that I was going to talk to in terms of a little bit of education on it, but I don't know if whoever was on the last session, I made up a fictitious coalition, and so I'll just kind of review that along with the tools. And as you scroll up in the chat, you'll see that Mary had posted in there a link to our Mountain Pacific site, and we'll continue to add resources and tools. And so by all means, if any of you have any good resources, whether it's coalition related or not, please send them our way. We're happy to review them, and if they are allowed to be on our website, we're happy to post them so everybody can kind of click on them. So again, last week we talked about Pleasantville Health Improvement Coalition, and we talked about how to identify issues within their coalition. And today we talked about the VMOSA methodology. So let's apply that to their coalition. So one of the first things we need to talk about is their vision, mission, and objectives, but we'll get to the objectives later. So from last week, we talked about the issue with increase in medication errors, coming back from a concern from tracking medication errors among the organizations within the community. and noticing discrepancies in how patients were taking their medications, including pain medications. They also recently began to transition to a new EHR, and there was some concerns and issues with that process. They're able to pull various organizations together and start to form their coalition. And one of their first activities, they conducted a qualitative assessment of their community by doing interviews to help understand their community in a pragmatic human factors way. That way, collecting quantitative data would not really give you that information. We also practice doing a form of root cause by doing the 5 whys to understand the problem at a granular level. And then some of the things our participants thought of is training wasn't done being properly, staff shortages and using contract staff, bad mentorship with enforcing around bad habits, lack of experience by staff. And those are just some of the issues that they thought of in terms of increased medication errors. And so then some of the solutions we talked about were just-in-time training, and we talked about details how to strategize the solution. But we did decide that coming up with this wasn't something that the coalition may best be suited to do, and that was working with our state nursing association for maybe doing a mentorship program. And so when we think about the work as a coalition, when I talked about earlier some of the strategies that coalitions can do, we have to think about the actual things that a coalition has access to change. So let me read their vision and mission. So their vision is create a community network of people working together to provide safe, coordinated, and effective healthcare across settings for Pleasantville area patients, beneficiaries, and families. Their mission is to improve coordination of patient care in the greater Pleasantville area by improving transitions of care and coordinated care across all settings, maximizing transfer of needed patient information and communication between care providers and settings, reducing avoidable emergency departments. And I'm gonna pause on those ones because actually I created those for something else, so sorry for the confusion. So by setting the vision, mission up before you start your work, it helps your coalition stay connected with a common purpose and gives consensus about what changes the coalition is capable of, like we just talked about. And we all like to dream big, but unless you have the resources to effectively and efficiently do your work, it'll just stay a dream and you'll end up with frustrated coalition members. So after your coalition is formed, remember that it's not a solid structure. It will flex and your work with the community will be organic, and you'll have conducted some analysis, both qualitative and quantitatively. You've done some interviews and gain a better pragmatic picture of the community. You reconvene and decide what your actual problem is. And a problem statement is a succinct statement of the problem that includes only the needs, not the solutions. Start with what you know and decide what is missing. Don't use assumptions in your problem statements. And one of the examples I'll give was from that toolkit that the U of Kansas created, and they gave an example of child hunger. No child should go to bed hungry, but 1/4 of all children do this in the country. So that problem statement versus children in our community are often hungry at the end of the month because their parents' paychecks are used up too early. So you can see the difference in those two problem statements, one's including some assumptions. So you want to be clear and to the point with your problem statement. So how do we frame our problem statement with our PHI coalition? Pleasantville Health Improvement Coalition. I know that also stands for Protected Health Information. And their coalition's concern for increased medication errors. So I have a tool, I think here. Dave, you just said, if any of you would like to join the Billings Care Coalition meetings on the 4th Thursday of the month at 7 a.m. Mountain Time, please send him a mail at eew@gmail.com.
I noticed I left off the COM, but I'm supposing all of you could figure that out. We've actually got meetings planned for the next 2 months. Next week, it's going to be about the behavioral health of seniors in isolation now for extended periods of time. I've got the head of the psychiatric department at Billings Clinic going to present. And next month, in an effort to sort of pivot ever so gently away from COVID-19, we're going to talk about healthcare literacy and the lack of it, especially in how hard it is to communicate with seniors about what they're to do when they go home from their care provider or when they're in any environment now when they're isolated. And also talk a bit about prescriptions, because as much as we'd like to think people understand the prescription their physician gives them, not the one that's written, but the one that's actually printed on the bottle, most seniors have a very hard time understanding that. So I'd like to invite anyone from any coalition or any participant to join us if they'd like to.
I appreciate that, Dave. And Dave, you also have a blog for your coalition, correct?
But if I send it out, it seems like it's blocked. I haven't quite figured out the technical way to communicate that, because most people that work at a place where there's a filter, the word blog somehow hangs up their
server.
anything about blog in it. So,
Well, you can try if you can pull up your website and then copy that link into the chat box. Might see if that, because it's not going to be going through an email. So when we think of our problem statement, and we know we went through the 5 whys, and we want to form our problem statement, how do we frame it? We talked last week about our concern with increased medication errors. And I just pulled up the wrong thing again. Sorry about that, guys. Oh. There we go. So we talked about, this is just the one that I kind of came up with here. So medication errors are increasing among all organizations within our community as evidenced by data collection. So it's clear, it's to the point, I'm not making any assumptions, I'm not putting any more into it. Would you all agree that that's an okay problem statement? Would any of you change it? Yes, yes, okay. All right. So then when we started doing that root cause, when we start, oh, was there someone talking? Nope. We started asking why. So we defined the problem and we asked why and why and why and why until we get to the root cause of the problem. So until you understand the very root of the problem, your solutions and strategies, they may not work to fully solve that problem. You're just going to end up with something that may not be beneficial. And again, this will lead your coalition down a very long, windy, confusing path that some may get lost in translation and some may turn around and go the other way, and some will, you get the point, they're just going to be confused. So when you start doing it, when you convene your coalition to set out to find the solutions for your problem, you have to be sure everyone, one, is in the frame of mind to do so. If you put people in a situation that's kind of exhausting, confusing, and can sometimes at times get heated, will even be worse if you start with people that may be uncomfortable or maybe not aware, or don't have all the data in front of them to start understanding how to find solutions or strategies to address it. And you'll just end up with a really mentally exhausted coalition. And know when to table your efforts and give your coalition's members a little break from their thinking caps. The process of coming up with ideas for solutions It really needs to involve having input from those who are ready to talk and not in a bad mood. And when you think about solutions, put it as an objective. So how about these for objectives for the coalition? And those were the ones that I had started reading off. To build a sustainable community care coalition focused on improving healthcare coordination, care transitions, and outcomes and care for patients served in the area. To improve medication safety and reduce adverse drug events of patients in the community, and to improve transfer of essential information during transitions from one facility to the next, specifically nurse report from sending facility, accurate reconciled medication list, discharge summary or related physician documentation from sending facility, so care transitions. Now that we have our objectives, think about how to strategize and implement actions. And some of the things to consider is cost, who can do the work, what other resources are needed, what kind of backup plan do you need to have, and how to prioritize your strategies. Let's see, how do you know the increases are not related to reporting improvements? Can you clarify that question, Jen? If you have the ability to unmute yourself. Should be a little, if you hover over the little taskbar thing, I can unmute you.
There, I found it.
There you go.
Yeah, I'm just curious as far as, maybe because it's being tracked, so they're tracking the errors more and more accurately than if the errors were previously being made, but they weren't being kept track of.
So if you're seeing improvements and there really hasn't been any interventions that there have been no interventions in place, it'd still be worth investigating. If you're starting with this baseline data and you collect it again in, let's say, 3 months, but you notice an improvement, but you didn't do anything, I would still look to see what that was, because you're going to want to take that and apply it to the other issues. If there's, let's say it's in a department in the hospital,
Right.
or, yep. Does that kind of answer?
Yeah, I guess I wasn't clear that there hadn't been any notification that this was kind of being looked at, or, it was just raw, continuous data, not a different project or a different, as you're saying, an intervention. Does that make sense?
Jen, Alana, this is Patty. Can I share something to Jen?
You sure can. Yep.
Yeah, so we do a lot of QI projects, and we always start with collecting the baseline data and validating it. And oftentimes we see improvement just because people now are entering it correctly in the workflow, in the EHR, for example. And we kind of count those as improvements because we at least now have better data to make decisions with, if that makes sense.
It does. And that's exactly what I was getting at. Like,
Yeah.
Okay, people are aware that you're looking at it. Sometimes they'll do a better job of recording and reporting. So that makes sense to me. Mm-hmm.
Very good question. Thanks, Patty. All right. So now putting your planning your actions helps to ensure that you have all your bases covered and you can prepare and anticipate challenges and barriers. Having a time frame to do an action plan, it really depends on how organized your coalition is. But once you establish all that foundational elements for a coalition, your action plan really needs to be up and running soon after that. And sometimes they'll say, 3, 6, 9 months, somewhere around there. And remember what I mentioned earlier about that VMOSA and the 5 types of specific strategies that coalitions can do, which were planning, training, and or enhancing skills, augment the services that are existing, map out access issues, barriers to resources, and identify opportunities to help improve the outcomes, provide opportunity for rewarding efforts, and so on. So, and then also to create, edit, or do away with policies. So how do you implement your solution? How do you do that? Setting up strategies to help ensure the objective is met for the problem, involves following certain questions and kind of when you establish a system and you establish a process, it's easier for your coalition members to contribute to, and then provide input in terms of what actions or changes will occur, who will carry out these changes or actions, by when will they take place and for how long, and what resources, and that includes, of course, money and staff and time burden, are changes needed to carry out, and then communication, who should know what. And I know somebody mentioned earlier too that communication was a key good coalition etiquette that they felt really helped with their progress. And putting these strategies into plan. So now you have the makings of a good strategic plan for your coalition, and a process and a structure. And so just because you decided on one way, and again, doesn't mean that things won't change, and you have to adjust your plan accordingly and flex a little bit. So I have this tool here. And again, I pulled this off of that website, and I can definitely bring that website up because it really does have some really good tools and resources in there. So the focus area objective, what's our objective of our coalition? Oh, it's not pulling up. Where is my? See here. So what did I say our objectives were? I'm sorry, I'm gonna have to go back a couple slides. There they are. To build a sustainable community care coalition focused on improving healthcare coordination, care transition, and outcomes, to improve medication safety and reduce adverse drug events. So let's use that. As our to how's that sound to everybody? That's our focus area. And what was our problem area? Our problem statement, sorry. Does anybody remember?
Medication errors are increasing.
Yep. Let's see. Hold up this one. Do you all agree that this is an okay problem statement? Medication errors are increasing among all organizations. And then if we thought about other collaborating organization or groups, is there anybody else in your organization? And I can think of, for instance, Missoula Community Coalition. Within that community, they have a very active opioid stewardship collaborative coalition. So I'd want to know, I'm working with them, I'm getting input from the organizations that are within the coalition. So I'm thinking about who else is doing similar work and who else would be able to contribute and collaborate with to help improve medication safety and adverse drug events. So our action steps, what needs to be done? Who will take the actions? By what date will the action be done? Resources available? What individual and organizations might resist? We have to think of those potential barriers or resistance. And then our communication plan for implementation. So step one, what needs to be done? Someone give me some shout outs. How are we going to improve medication safety and adverse drug events? I know some of you have probably worked on this before or working on it now, maybe.
So for me, number one is, this is Amber, is always collecting baseline data. I know that you've kind of had that before, but that needs to be agreed upon what the numerators, denominators are, who's going to get it, who's going to contribute, blah, blah, blah.
Yep. And so realistically, how much time would it take for us to collect baseline data? I think I saw Dorada on here. Maybe she wants to speak up.
Well,
Sure, yes, I'm on. I mean, it depends of the availability of data. I mean, if ideally it would be nice to have a year of data, but you can do one point, if you're doing a quick and dirty sort of look at it, you can do a 1 point scan data collection and go from there and explore other data sources as you go down the line to continue with your assessment.
Okay. So if we wanted to think a little bit more detailed in this step, we would want to define what our time period would be for data collection for one. Thanks, Mark. Just reading some comments here, Kyla, make sure medication changes are communicated to all providers after med changes. Debbie, data and problem analysis. Mark mentioned medication therapeutic management. So I would say if we're going to collect baseline data, realistic time burden for all of our coalition members and for everybody, as we've all have been talking about, the amount of time that someone can spend in a coalition is very limited because most of us are already working within an organization and have a JOB that takes most of our time. But that's why when you define your mission, vision, purpose, and your objectives, things like that, it may align with what they're already internally trying to do in their organization. So you're more likely going to have people that are going to want to contribute and collaborate with you, and you'll have more people to help out. That makes sense. So realistically, I would say let's give people what? 30 days, a month?
Yeah, this is Shelley with HMSA. I was thinking 30 days because for the most part, most people, if you've already identified this as a problem, for your baseline data, that means you've already seen some of it that you know it's a problem. Mm-hmm. So they've already got it. We just want to make sure that everybody's sending the same kind of data so we're comparing apples to apples.
Right. Right. So who's going to take the actions? Do we have a few people that might, when we talked earlier in one of the other sessions, we talked about kind of doing a skills inventory. Maybe somebody has a little bit more knowledge and bandwidth to be able to collect and analyze data for our coalition. So if we know that ahead of time, working with them, what's your time frame? How much time can you dedicate to this? And then fill in the gaps, like we need XYZ done. Oh, Jane Doe can do that. She said she's got extra time and she's happy to help wherever. So let's just call Jane and Doe. Okay. So by what date will the action be done? And by this, we already said 30 days. So what is today, July 16th? So let's just, I know it's probably not 30 days exactly, but August 15th, 2020. Resources available. We have what are some skill sets? Maybe we work on and call out some of our coalition skill sets. So maybe we have someone We have a data analyst as a coalition member. We have access to EHR. I don't know. I'm just throwing stuff out there. Anybody have any ideas, like how would you identify resources for your coalition? I talked about time, money, your coalition members. And so when I think about collecting data and we're talking about medication safety and adverse drug events, some resources needed: financial, human, political, and other. So all those external kind of resources that we may not have access to. So for the sake of time, it's 4:01. Those of you who need to jump off, I will not be offended if you drop off. We can definitely kind of resume this if we do. Like I said, we talked about doing some data training, some COAPI training within Mountain Pacific. And I'm guessing this will be probably not until after August or September, somewhere around there. So I do appreciate everybody's time today, that you have stayed on and been patient with me, fumbling around. If you have any last words of wisdom or any questions, comments. If not, I guess we will conclude our final series. And again, thank you everyone for joining today. Have a very happy rest of your Thursday.
Thank you.